Okay, so hello dear doctors. I hope I am audible, visible. Okay, good evening, good evening, good evening, all of you. Namaste, 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 ji. So, my dear doctors, I'm Dr. Dinesh, and we are going to discuss the Predictor series FMGE Pharmacology. Very important topic we are going to discuss with MCQs, and definitely you are going to enjoy. So, bache, I hope I'm audible and visible. Just show me the thumb if I'm audible, visible. Please show me your thumb. Yes. I'm good. I hope all of you are good. If having anxiety, I told you anxiolytic drugs. Right. So I will tell you the important topics and their MCQs. Please try to interact, give the answers so that you will enjoy. Okay. Show me the thumb if I'm audible and visible. Okay. Okay, guys. So let's start without wasting the time. So let's. Okay. Thank you, guys. Thank you. So let's start. A very important topic, diabetes mellitus. Very important topic, diabetes and dyslipidemia. Diabetes and dyslipidemia, very important topic, bachcho. Very important topic. The question is, mechanism of action of semaglutide is diabetes in mellitus is, semaglutide, a very important drug, semaglutide in diabetes mellitus. What is the mechanism? I told you anti-diabetics, especially the latest anti-diabetic drugs, very important drug. No बच्चे रचित, don't use alprazolam, it is sedative. Exam में सोते रह जाओगे. No, right? Okay. So mechanism of action, it is analog of GLP, it is DPP4 inhibitor, it is SGLT2 inhibitor, it is amylin analog. So guys, what is the answer? And I can see most of you have given the wrong answer. No, बच्चे, please think logically and give the answer. No hurry, no premature. I told you, right? Take your time, take 10 seconds extra and then give the answer. Mechanism of action of semaglutide, glutide or natide, exenatide, liraglutide, semaglutide, nowadays anti-obesity drug also. Semaglutide is the oral drug. The only oral in this category is sema. I told you sema is orally. So semaglutide, the oral drug in this category in diabetes mellitus, nowadays used as anti-obesity also. So what is the correct answer? So bachche, let's see. SGLT2 inhibitor, some of you are saying SGLT2 inhibitor. No. SGLT2 inhibitors are gliflozin. These are gliflozin, dapagliflozin, empagliflozin. Amylin analog, no. This is pramlintide. Amylin, you can see amylin. So that is amylin. So no C, no D. Now let's see the B and A. DPP4 inhibitor, dipeptidyl peptidase 4 inhibitors are gliptins. These are gliptin, sitagliptin, vildagliptin, linagliptin. I hope you remember. So now you know what is the correct answer. GLP analog, GLP, glucagon like peptide, and it is having the effect on insulin secretion. What is the name of the drug? It is semaglutide, liraglutide, dulaglutide, exenatide. And I told you, don't forget dula. Don't forget semaglutide, Now don't forget the dulaglutide, exenatide, liraglutide, they all are available. And one important drug is tirzepatide. Don't forget the tirzepatide also. Tirzepatide is the drug which is having the dual action, and that is also anti-obesity. So it is GLP-1 as well as GIP, both. So tirzepatide is both. It is glucagon like peptide, GLP-1 as well as GIP, glucose dependent insulinotropic peptide. तो ग्लूकागोन लाइक पेप्टाइड, ग्लूकोज डिपेंडेंट इंसुलिनोट्रोपिक पेप्टाइड, बोथ मैकेनिज्म दैट इज GIP. तो GLP and GIP both is tirzepatide and that is also approved for diabetes as well as anti-obesity. So liraglutide, semaglutide, GLP, tirzepatide is dual. Don't forget, very important topic from anti-obesity and diabetes. So any bachcha log, can you tell me which drug is used for short bowel syndrome? Any bachcha, which drug is used for short bowel syndrome? Short bowel, that is GLP-2. These are GLP-1, GLP-2 is there, short bowel syndrome. Any bachcha, give the answer. GLP-2. So don't forget the mechanism of anti-diabetics and their main side effect. Don't forget anti-diabetes drug, mechanism of action and their main ADR. Very good बच्चे, very good, very good. Teduglutide, so don't forget the teduglutide also. Teduglutide is GLP-2, very good, GLP-2, and that is short bowel syndrome treatment. Teduglutide is short bowel syndrome treatment. Very good बच्चे लोग. So I told you 3-4 important points, don't forget these points. Okay, let's see the another question. Very important topic, dose response curve or DRC. So we can find therapeutic index. We can find therapeutic index of a drug. I hope you know the therapeutic index, very important topic. From the information given below in the graph, this graph is a type of, this graph is a type of, this graph is a type of. So which type of graph is this? So you can see the graph, it is therapeutic effect given, toxic effect given. This is number of people, so number of subject, 10%, 20%, 50%, 100%. Median effective dose is given, ED 50. Median toxic dose is given. So this is dose response curve. Which type of curve is this? In the curve which can show us the therapeutic index. Quickly give the answer. Therapeutic index is the ratio of TD or LD 50 divided by ED 50. Everybody should remember the therapeutic index and dose response curve. And now let's see what is the correct answer. The options are graded DRC, quantal DRC, time versus plasma concentration. So it is not time versus plasma concentration. That is important for bioavailability. You know the area for bioavailability, extent of absorption. It is not excretion versus time curve. It is not excretion versus time curve. तनवीर जी बेटा मैंने वो दिखाने के लिए इसको थोड़ा जूम किया था, तो डोंट वरी, स्क्रीन वापस नॉर्मल है. So now graded DRC and quantal. So you can see if you cannot grade the response, you have to take the quantity of subject. I have told you everybody in the classroom as well as many times whenever you meet me कि बच्चा DRC is very important. Quantal DRC, number of subject. So that is quantal DRC. All of you have given the correct answer, but don't forget the grading. And you can grade the response. In quantal you have to quantify, it means the number of subject is required. So therapeutic index can be determined by the quantal DRC. If therapeutic index is less than 2, if therapeutic index is less than 2, that is narrow therapeutic index, that is narrow therapeutic index. Okay, yes bachche, I love you all, don't worry, right? First we should love the FMGE exam, उसको निकालना अपने को, right? फिर आ जाना सब मिलने के लिए. So if therapeutic index is less than 2, that is narrow therapeutic index. Okay, don't forget the help in graded DRC. Don't forget the help. I hope everybody knows the help. Help, HELP. Height for efficacy, left side for potency. Don't forget height for efficacy and left side for potency. Don't forget that, right? Don't forget the help, graded DRC. And if the graph shift to right side, which type of antagonism is this? Tell me, which type of antagonism is this? If the graph shifted to right side, which type of antagonism is this? Tell me bachche. If the graph shift to right, is it competitive or non-competitive? Which type of antagonism? And then we will discuss the next question. A patient with acute chest pain. Patient with acute chest pain was given nitroglycerin. Patient having chest pain given nitroglycerin via sublingual route. Chest pain was relieved within 5 minutes. तो relief within 5 minutes. Very good बच्चे. Right में कब shift होना है? Competitive. In competitive exam we always go in the right. Very good. What is the mechanism of causing vasodilation by nitrates? So by which mechanism nitrates causing vasodilation? Very important. Again, the mechanism and side effect, these two are very frequently asked question. Okay, so nitrates, they release the nitric oxide, indirect nitric oxide donor, and they decrease the preload, they decrease the end diastolic volume. So what is the mechanism? Release of endothelins, calcium channel blockade, release of nitric oxide and increase the cyclic GMP, or phosphodiesterase inhibition, increase the cyclic AMP. What is the correct answer? So don't forget the vasodilator, especially these two, don't forget these two. So what is the mechanism of this drug? So calcium channel blockades are dipins. These are dipin, amlodipine, nifedipine, slavidipine, very safe in asthmatic patient, used to treat the hypertension. Release of nitric oxide increase the cyclic GMP. Yes, very good बच्चे. So this is cyclic GMP increase, release of nitric oxide. Yes, in the quiz only we have discussed these questions na, so we are discussing those questions only. So increase the cyclic GMP, release of nitric oxide. These are the same questions. Medic load, name is good. So guys, increase the cyclic GMP, and this sildenafil is having the same mechanism. The sildenafil, tadalafil, they have the same mechanism. Viagra, the drug for erectile dysfunction, having the same mechanism. That's why we don't use nitrates with sildenafil. Otherwise there will be vasodilation and reflex tachycardia. So we are using nitrates for this patient. Yes, nitroglycerin can be used. There is no doubt. Nitroglycerin is very safe drug, very quick and fast acting drug. Okay, bachche, next question. A 52-year patient came to the emergency with severe chest pain. His blood pressure is 150/94 and diagnosed with chronic angina pectoris. It means the patient is having repeated history of this pain. What is the drug used for hypertension? Don't be confused. The drug for hypertension they are asking. What is the drug used for treatment of this hypertension, this blood pressure? Which drug you will give to this patient? Any bacha? Very important. Very important. So the patient of angina having hypertension, antihypertensive drug in angina or coronary artery disease patient, ischemic heart disease patients. Which antihypertensive drug is preferred for angina? Very good यार, आप सबको तो सब कुछ आता है. Very good बच्चे, मजा आ गया. So Ramipril is ACE inhibitor. These are wonderful drug for antihypertensive, for CHF, for diabetes. These are wonderful antihypertensive drug for CHF patients, diabetes patients. Atenolol is a beta blocker and that is wonderful drug for these angina patients. Very good बच्चे. No, medic sahab, rifampicin is the correct answer without any doubt. Rifampicin is the correct answer without any doubt. Amlodipine is the calcium channel blocker and they are wonderful drug in asthmatic patient. And it's a wonder. The question, if you read carefully, the question was accept. Then the answer will be valproate. If accept was the question. Asthmatic, or it is a wonderful drug for asthmatic patients and peripheral vascular disease patient. So which is the antihypertensive for asthma and peripheral vascular disease? Then the answer will be calcium channel blocker. And then we have the diuretics, thiazides. Thiazides are wonderful drug for edema patients and wonderful drug for osteoporotic patients. So in these type of patients, the selection of antihypertensive drug, I have told you how to select the antihypertensive drug. So the answer is atenolol, right? So I hope you understood now. So this is the correct answer. So don't forget the antihypertensive selection. First line antihypertensive drugs are A, C and D. Beta blockers are not first line antihypertensive, but in heart patients they are the wonderful drug. Okay, next question from some CNS topic. An elderly patient came with the rigidity, hypokinesia and tremors. All of the following drug may be prescribed to this patient as a monotherapy except. Options are, yes, definitely doc we can definitely give the these diuretics in the CHF patients, but not a first choice drug, because they do not decrease the mortality, they don't have any effect on the disease progression, they only give the symptomatic relief. Okay, so the patient is having rigidity, the patient is having slow walk, hypokinesia and tremors, pill rolling tremors. Which drug is used as a monotherapy except? Read the question, except. Okay, so let's see the options. Levodopa, ropinirole, carbidopa and salazilin. Levodopa is a dopamine precursor. Ropinirole is the dopamine agonist. Carbidopa is peripheral dopa decarboxylase inhibitor and salazilin is MAO-B inhibitor. So because it is the MAO-B inhibitor, it inhibits the metabolism of dopamine. Carbidopa is dopamine dopa decarboxylase inhibitor. Ropinirole is dopamine agonist and levodopa is dopamine precursor. So you can see the drug which increase the dopamine effect can be used in Parkinson. They can be started as monotherapy as well as you can combine as add-on therapy. So you can give this one, you can give this one, you can give this one as well as this one. Peripheral dopa decarboxylase inhibitor, carbidopa is not used alone. Carbidopa is a drug which is given with levodopa. Just to increase the effect of levodopa, we add the carbidopa. So the benefit of carbidopa, the effect of levodopa will be more, the side effect of levodopa will be less. The main purpose is to enhance the effect of levodopa. So it is a synergistic drug with levodopa. There is no role of carbidopa alone. So these are the drugs we use for Parkinson. Don't forget to revise the anti-Parkinson drugs. So very important topic, Parkinsonism. Okay, a person suffering from, everybody forgot the COVID, but I always say COVID is important topic. They can ask the question. Suffering of COVID was prescribed hydroxychloroquine and azithromycin. And if you see carefully, this question is not from the COVID. This question is from the hydroxychloroquine and azithromycin. The patient came with the chest pain next day and ECG showing the ECG was advised. Which adverse effect it could be and what is the drug causing this problem? So this is basically long QT syndrome, torsades de Puentes. This is long QT syndrome, torsades de Puentes. Which drug is this? Is it azithro, hydroxychloroquine, both or none of the above? So which drug can cause long QT syndrome or torsades arrhythmia? So don't forget again to revise the drugs which are important for torsades. So I told you the drug causing torsades arrhythmia. Don't forget. So which can cause torsades arrhythmia? Azithro as well as hydroxychloroquine, anti-malarial drugs and macrolides, both are having the risk of long QT syndrome. And bache, what is the treatment of long QT syndrome? The treatment is magnesium salt. So don't give the magnesium to treat long QT syndrome. Magnesium is the drug for acute attack. Propranolol beta blocker is the drug for congenital. Beta blocker is the drug for congenital. So not only B bache, Omkar Saab, it is the both drug which are causing cardiotoxicity or long QT syndrome. And if you combine these drugs, the risk is more because macrolides are CYP inhibitor also, and they increase the risk of HCQ toxicity. So don't forget the hydroxychloroquine, chloroquine toxicity. One important toxicity is bullseye maculopathy. Don't forget the bullseye. Don't forget the bullseye maculopathy as well. Right? So these are important adverse effect of HCQ. Okay. Next question. A person is suffering of COVID disease. A person is suffering of COVID disease. He was admitted to the hospital and the treatment was started. Again, this question is not related to only COVID. This question is basic question from the viral infection. Which statement is not true in this? Which statement is not true in this? Options are antiviral remdesivir should be given in replicative phase, steroid should be given in the inflammatory phase, enoxaparin should be given to all admitted patients, and hydroxychloroquine should be given for all admitted patients. So which is not a true statement. So in COVID-19, or you can see the viral infection, antiviral, so in any viral infection there is role of antiviral only in the replicative phase. So that is absolutely true. What is the role of steroid? The steroids are used in inflammatory phase. That is also absolutely true. So they can be combined in other antiviral also, which is chronic viral infection, sorry. Enoxaparin is low molecular weight heparin. It is the low molecular weight heparin. Subcutaneous injection is available. It is about the admitted patient. If the patient is admitted, that means the patient is sick. The patient is sick. And if the patient is sick, definitely we need this, right? Adi is asking ki sir, why we give enoxaparin? So bachche, due to viral, this virus is basically foreign body, and because of this foreign body, what happens? DIC, disseminated intravascular coagulation, and to control this intravascular coagulation we need to give the anticoagulant. If the patient is not admitted, mild infection, we can give oral anticoagulant, but this patient is admitted, so we can give the injectable drug. Okay. Hydroxychloroquine should be given to all admitted patients. No, HCQ is having no role. HCQ, latest study is saying that there is no role of HCQ in this, right? Yeah, definitely there is risk of coagulation cascade, DIC, disseminated intravascular coagulation. So it can cause the coagulation, coagulopathy, and you see many patients, the patient is dying because of this coagulopathy. Okay, so HCQ is not having any role in COVID, so it was basically a myth. There is no role of HCQ. So don't forget how to use the antiviral, how to use the anti-inflammatory in the viral infection. Okay, the next question is again very simple and tricky question. Histamine through H1 receptor causing bronchoconstriction, and adrenaline through beta receptor causing bronchodilation. To reverse this action, which type of antagonism is this? The question is about the type of antagonism. Options are physiological, pharmacological, competitive, and receptor antagonism. Which type of antagonism is this? Very important question, frequently asked topic, anaphylactic shock. So this question is from the anaphylactic shock. And bache log, everybody, yes, very good. So some of you are giving the wrong answer, but most of you are giving the correct answer. So the receptor is different. The receptor is different. You can see H1 receptor, beta 2 receptor. Both receptors are different. So it is not receptor or pharmacological. Receptor or pharmacological is same. So it is not receptor, not pharmacological. No competition if there is no same receptor. Competition only occurs in the same receptors, right? Total how many number of questions from pharma side? Bacha 25-30 question लिख के ले लो, right? You will see around 25-30 questions. If you will read pharmacology, very scoring subject, you will be definitely getting the good score. So it is the physiological antagonist, and the important topic is anaphylactic shock. That's why we use in anaphylactic shock, we use the epinephrine. You know the dose of epinephrine, that is 0.4 milligram, 1:1000 solution, and it is given intramuscular. 0.5 milligram, 1:1000 intramuscular. If receptor is same, it is definitely pharmacological antagonism, and mostly it is competitive antagonist, but it could be non-competitive as well. A very important question from the chemotherapy. In chemotherapy, the question will be mostly from the adverse effect of chemotherapy. A patient was on anti-cancer therapy, started suffering from anemia. It could be anemia, it could be neutropenia, it could be thrombocytopenia, dose-dependent toxicity. The total RBC count of this patient is 2 million cells per microliter. So normally it is 4 to 5. So it is very low. Which medication will be effective? Options are filgrastim, oprelvecin, darbepoetin, molgramostim. Lord Saab, I guarantee if you will crack all the question, Dr. Zedan, definitely you are going to pass. I guarantee. Right? So don't worry. Okay, so let's see filgrastim granulocyte stimulator. So this is the drug for neutropenia. This is the drug for neutropenia. Filgrastim granulocyte stimulator. Granulocyte monocyte stimulator. So that is also used for neutropenia. If you see oprelvecin, it is interleukin 11. See the name oprelvecin. So name it is 11, right? So it is for thrombocytopenia. It is for thrombocytopenia. अंकिता जी इतना कर लो, मोर देन सफिशिएंट, डोंट वरी, बट घबराना नहीं है बस अभी. डार्बोपोइटिन, that is the drug recombinant erythropoietin group and used for anemia. So don't forget this. And you know there are three important drugs which are bone marrow sparing. So you know what is the name of these bone marrow sparing drug? This question is for you guys. What is the name of the drug bone marrow sparing? We have the three A, B, O. So what are the three drugs? O for oncovin. Oncovin is vincristine. What is A and what is B? बिल्कुल बिल्कुल CBT यार उसी हिसाब से तो बनाया जा रहा है. Okay, okay. A patient is on treatment of acute migraine. Very important. Acute migraine or chronic migraine. Very important drug. So B for no, not busulfan, not busulfan. Yes. A for asparginase. A for asparginase. हाँ बिल्कुल आदि साहब वही तो बताया. तो A for asparginase, B for bleomycin, not bosomycin. अपनी मर्जी से बना दिया bosomycin, bleomycin. तो A for जो है asparginase enzyme, B for bleomycin, and O for oncovin vincristine. A patient on the treatment of migraine. Very important topic. Acute migraine, chronic migraine. Develop tingling and numbness at the tip of finger. 3 question है. In the acute MI, then there is risk of acute migraine. The drug which are risky in ischemic heart disease patients. The drug which are risky in asthmatic patients. Nowadays we give the scalp injection. These are important questions from the migraine. So this is tingling numbness in the finger. So which drug is responsible and what is the treatment? So which drug is responsible? शाबाज जी हम तो एक्सपेक्ट कर रहे हैं सारे आ जाएं अगर वो माने तो. ओके, सो व्हाट इज द आंसर? नो बच्चे, प्रजापति साहब, डाकारबाजिन इज नॉट बोन मैरो स्पेरिंग. ओके ओके, सो गाइज व्हाट इज द आंसर? लेट्स सी. The drug used in acute migraine develop numbness and tingling at the tip of finger. So which drug is having risk at the tip of finger and artery vasoconstriction? And artery vasoconstriction, it is the ergot compound, not sumatriptan. It is the ergot compound. Even propranolol having some risk, even caffeine is having some risk, but mostly it is the ergot compounds. And we have to give the vasodilators. We have to give the vasodilators. So the correct answer is ergot compounds. So ergotamine. That's why triptans are the preferred drug. That's why triptans are the preferred drug. We prefer the triptan. Rizatriptan is best. Rizatriptan is the fastest acting. That is best drug in acute. And don't forget the meditans. Meditans are acting on 5-HT1F. 5-HT1F meditans. And that is also a wonderful drug. So in heart patients, we don't use the ergots and triptans. Hypertensive patients also. In asthmatic patients, we don't use the propranolol. That is for chronic migraine patients. Okay, very simple question. Very simple question. Shortest acting corticosteroid among the following is shortest acting. Dexamethasone, hydrocortisone, triamcinolone or methylprednisolone. Shortest as well as fastest. Shortest as well as fastest. Shortest as well as fastest. So it is the dexamethasone, hydrocortisone, triamcinolone, methylprednisolone. अभी आएगा बच्चे, आएगा 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 आएगा. Don't worry. Don't worry. Okay. So tell me बच्चे, what is the shortest and fastest acting drug? Yes, most of you are giving the correct answer. It is hydrocortisone. Hydrocortisone. Dexa is very long acting. Dexa is very long acting drug, very strong drug, highly potent as well. Highly potent as well. And you know this triamcinolone is the intralesional steroid. Intralesional, or you can say the intralesional steroid, directly in the lesion. Even methylprednisolone can be used, but methylprednisolone is available oral as well as IV. Medrol. So hydrocortisone is the drug for emergency. Okay, let's see which of the following anti-epileptic drugs. So the बच्चा जो पूछ रहा था अभी देख लो. To start in a female for treatment of myoclonic epilepsy. A female suffering of myoclonic epilepsy, which anti-epileptic drug you will start? Tell me बच्चे. Valproate, carbamazepine, phenytoin or lamotrigine. In myoclonic epilepsy, definitely valproate is the first line drug. There is no doubt. Valproate is the overall drug of choice. But in female we don't start, and you know myoclonic is mostly seen in the young. So in female we don't start the valproate because it is risky, right? It is risky, you know, PCOD and all, and ultimately neural tube defects. So in these patients we use the L group of drug, levetiracetam, or we use the lamotrigine. These are the drugs we use in female. That's why the answer will be lamotrigine. Valproate, carbamazepine, you know, phenytoin, these are risky drug in the females. Valproate is especially PCOD risk is high. So that's why we use the L group of drug, right? So that's why the answer will be lamotrigine. So don't forget to revise the table of first line drug in epilepsy. Okay. One question from UTI. Okay. Myoclonic epilepsy seen in the प्रेगनेंसी में भी बच्चे सूर्य प्रकाश यही, और यहाँ पे भी यंग फीमेल लिखा हो तब भी यही, फीमेल लिखा हो तब भी यही. A female with 20 weeks pregnancy present with fever and dysuria. Preliminary diagnosis of cystitis. It means lower UTI. Which of the following drug will be safe to use in a patient who is female? So which antibiotic you will start? So out of these, ciprofloxacin is a fluoroquinolone. These are not safe in pregnancy, not safe in children. Gentamicin is aminoglycoside, not safe in children, not safe in pregnancy because fetal ototoxicity risk is there. Cotrimoxazole is sulfa drug. Sulfa is not safe again. Sulfa is not safe. Penicillin like amoxicillin, ampicillin, these are safe drug. So don't forget penicillin, cephalosporin and macrolides. Penicillin, cephalosporins and macrolides are safe in pregnancy. Penicillin, cephalosporins, macrolides are safe in pregnancy. So PCM, these are safe. Amoxicillin, ampicillin you can start in pregnancy, no hesitation, right? So just to tell you which drugs are safe in pregnancy. So don't forget to revise the drug of choice for urethral infection, urinary tract infection or genital infection. One question is definitely coming from either urethritis or genital infection like gonorrhea, syphilis, B vaginosis, candidiasis, vaginal candidiasis. So you will get one question from these for sure. Okay. Which of the following insulin preparation is peakless insulin? Very simple, but classification of insulin and hypoglycemia is very important. So which are the peakless insulin? It means 24-hour action. 24-hour action, it means longer action. So out of these, which is longer acting insulin? So Lispro, Aspart, these are ultra short and these are rapid acting, not long acting. These are very short. NPH or isofen, this is intermediate. So yes, Glargine is the large. So I told you Glargine, Degludac and Datamir. These are the drug. तो डट के रहो, डेग्लूडैक ग्लू की तरह चिपक जाओ, और लार्ज. सो दीज आर द ड्रग्स विच आर वेरी लॉन्ग आउट ऑफ इंसुलिन. तो ग्लार्जिन इज 24-hour एक्शन एंड डेग्लूडैक इज 42-hour एक्शन, वेरी लॉन्ग एक्टिंग. एंड हाइपोग्लाइसेमिया इज द कॉमन साइड इफेक्ट. Okay guys, very important question. Praziquantel is used for the treatment of C is cephalosporin. Sneha ji, C is cephalosporin. So praziquantel used for the treatment of strongyloidosis. The drug of choice is ivermectin. Trichomoniasis. The drug of choice is metronidazole. Schistosomiasis and rhinosporidiosis. In rhinosporidiosis, main treatment is surgery, but you can also use the medical treatment, that is sulfa or dapsone. So now you got the answer. Schistosoma hematobium. This is blood fluke. And you know what is the drug of choice for fluke? What is the drug of choice for fluke? What is the drug of choice for fluke? In fluke, the drug of choice is praziquantel. In all flukes, the drug of choice is praziquantel, except all flukes except one. And you know what is this except? This is liver fluke. Liver fluke, fasciola hepatica. Triclabendazole. Triclabendazole is drug for liver fluke. Otherwise, in all fluke, the drug of choice is praziquantel. Even in this platyhelminthes, we use the praziquantel. So not only for fluke, also for platyhelminthes, cestodes also. Okay, so don't forget this. So don't forget to revise the drug of choice in antihelminthic. Okay, a young female present with reduced sleep, fluctuating mood. She has a family history of bipolar disorder. Which of the following drugs should be used for long-term treatment of this patient? So patient of bipolar disorder, the treatment is long-term. So they are asking the prophylaxis of bipolar disorder. But don't forget, she is a young female. So in bipolar disorder, we give the drugs. Lithium, we give the drug valproate, we give the drug lamotrigine, carbamazepine. We don't use fluoxetine in this patient. Why? Because fluoxetine, there is risk of mania. We never use SSRIs in bipolar disorder because the patient will have the risk of mania attack. So we don't use SSRIs alone in these patients. No, not SSRI. So fluctuating mood, bipolar disorder. So what is the treatment or prophylaxis? Sorry. So we can use B, C and D, but she is a female, she is young. So think about the pregnancy, think about the conceive. She may conceive in future. So we don't use these drugs. Again, the L group of drug, lamotrigine. So in these patients, either lamotrigine or antipsychotic drug we start. So in these patients, either lamotrigine or antipsychotic drug we start. Antipsychotic is not good, mood stabilizers. That's why anti-epileptic drugs like lamotrigine definitely we are going to start. So don't forget this. Lithium is again not safe for this patient. In rapid cyclers, we use the valproate. So don't forget to revise the bipolar. All these topics are very important, guys. Drug of choice for treatment of Alzheimer's, drug used for treatment of Alzheimer's disease available in transdermal patch is R. Pyridostigmine, rivastigmine, physostigmine, donepezil is not R because we have to select one only. So pyridostigmine, rivastigmine, physostigmine or donepezil. What is the correct answer, bachcho? The drug available in transdermal patch. Diyaji, I am not asking the best drug. I am asking the drug available in the transdermal patch. So Alzheimer's is very important topic. Dementia. We use cholinergic drugs. So all these are central cholinergics. All these are central cholinergics. Not all three, all four, these three. These are central anticholinergics, not pyridostigmine. So neostigmine, pyridostigmine is not for this purpose. They are the drug used for myasthenia gravis because they have the peripheral action, mainly nicotinic action is there. So out of these we have to think. Other than this, we use the memantine. Memantine is the drug which is NMDA blocker. That is NMDA blocker. So we use these drugs for dementia. NMDA blocker. So bache, out of these, overall best is definitely donepezil. But The drug which is available in transdermal patch form is rivastigmine. The drug available in the transdermal patch is rivastigmine. So don't forget the rivastigmine transdermal patch. Don't forget rotigotin, NMDA blocker. Don't forget the rotigotin. Rotigotin is the drug for Parkinson. Rotigotin patch is available for the Parkinson. So new drug rotigotin. So rotigotin for Parkinson, rivastigmine for Alzheimer's. So again, very important topic, neurodegenerative disorder. And how can we forget the gout? You know, favorite question in FMG. A patient suffering from pain in the right first metatarsophalangeal joint has given the drug allopurinol. What is the mechanism of this drug? Very important. Very important. Is it xanthine oxidase inhibitor? Is it the recombinant uricase? So let me tell you, it is RAS buricase. Decrease chemotaxis, that is colchicine. Increase the uric acid excretion, these are uricosuric drugs like probenecid, sulfenpyrazone. So what is the name of the drug? Xanthine oxidase inhibitor. Very good bachche. So also nowadays we use the febuxostat, allopurinol xanthine oxidase inhibitor used for the gout patients. In chronic gout, allopurinol febuxostat is best. In acute gout, NSAIDs are best. NSAIDs, but in refractory cases, colchicine is the important drug. Colchicine, because colchicine is common side effect is diarrhea, but colchicine causing bone marrow suppression risk. That's why we don't prefer colchicine in all the patients. Again, a very simple but very frequently asked topic, the antihypertensive drug which is having high risk of dizziness on getting up from the bed. So basically they are asking the postural hypotension, and let me tell you, this topic is basically important because they are asking the drug for BPH. In BPH, benign prostatic hypertrophy, BPH patients, we are using this drug. So the options are metoprolol, terazosin, ramipril or indapamide. So which drug used in BPH having the high risk of dizziness, postural hypotension, we prescribe in the night only. So what is the drug? Metoprolol, terazosin, ramipril or indapamide. So guys, alpha blockers are having high risk of, the high risk of this, right? So all these drugs are osin. So terazosin, prazosin is having highest risk, also used for scorpion bite. Yes, very good bachche. So prazosin, terazosin, doxazosin, alfuzosin, tamsulosin, silodosin. Tamsulosin is safer, that's why that is preferred in the BPH. But out of this, terazosin is having the high risk of postural hypotension. So don't forget to revise the BPH again. The drug which is 100 times more potent than morphine. 100 times, so which is the strongest opioid, which is the most potent opioid. Options are tramadol, fentanyl, pentazocine or pethidine. Important question. These all are opioids. Tramadol is having norepinephrine reuptake inhibitor property. Fentanyl is highly potent drug. Pentazocine is having kappa agonistic property, risk of psychomimetic effect. Pethidine is the drug which is also called as meperidine, mainly used for post-op patients, also used for post-op shivering. Pethidine, tramadol. So out of these, most potent fentanyl group, 100 times more potent. And you know, sufentanil is the overall most potent. Sufentanil is overall most potent drug, and remifentanil is very short acting drug. And you know the important side effect of fentanyl group. Any bacha, what is the important side effect of fentanyl group when we used in surgery? What is the important side effect of fentanyl? Any bacha, what is the important side effect of fentanyl group? Tell me. What is the important side effect of fentanyl group? Wooden chest syndrome, tightness in the chest. No, febuxostat is not for rheumatoid arthritis, bache. Febuxostat is for gout. Exostat, xanthine oxidase inhibitor. For rheumatoid, methotrexate. Biological agents. Therapeutic drug monitoring, TDM. TDM is useful for which drug? Therapeutic drug monitoring. Don't forget the Lat Diya. Don't forget the Lat Diya. Lithium aminoglycosides, amitriptyline, theophylline, digoxin, immunosuppressant, anti-epileptics. All these drugs are there. So phenytoin, yes. Theophylline, yes. Lithium, yes. So answer will be all. So in all these drugs we do the TDM. And don't forget the lithium normal level 0.5 to 1.2 milli equivalent per liter is normal. If the level is more than 1.5, it is toxic. If the level is more than 2, you will see the tremors. If the level is more than 4 to 5, you need the dialysis. So lithium level is very important. Don't forget. Lithium toxicity risk is there. Coarse tremors are the sign of toxicity if the level is more than 2. A very important question, anticoagulant, platelets. Hematology, antiplatelet, anticoagulant, and dyslipidemia. Very short, crisp, but frequently asked topic. So guys, oral direct thrombin inhibitor. Simple question, oral direct thrombin. So dabigatran, rivaroxaban, argatroban, or lapuridine. What is the answer? Dabigatran, rivaroxaban, argatroban, lapuridine. It is orally. So guys, these two are oral. These are injectable, parenteral. Now see, XA-ban, that is direct 10th A inhibitor. Dabigatran thrombin antagonist, so that is direct second, or you can say the thrombin inhibitor, dabigatran. Argatroban and lapuridine, these are injectable second A thrombin inhibitor. So the answer is dabigatran. And don't forget the antidote. Don't forget the antidote. Idarucizumab. याद रखो, दबा के दारू पीनी है. Idarucizumab और dabigatran. Idarucizumab. तो दबा के दारू, Idarucizumab. दारू. And for this, Endexa. Antidote for Dexa. Endexanet alpha. So these are antidote, Idarucizumab and Endexanet alpha. For second it is Daru, for 10th it is Endexa. So antidotes are also important. Okay, the important anti-cancer drug used in lymphoma and leukemia, but most cardiotoxic anti-cancer drug. The drug used in lymphoma and leukemia, but most cardiotoxic anti-cancer drug. Anthracycline, cyclophosphamide, trastuzumab, and dactinomycin. So guys, anthracycline, cyclophosphamide, trastuzumab or dactinomycin. The drug used for lymphoma, leukemia, and most cardiotoxic. So guys, trastuzumab is the drug for breast cancer. It is cardiotoxic. But it is for breast cancer. Dactinomycin causing radiation recall reaction. These two drugs are cardiotoxic and can be used for lymphoma, leukemia. Out of these, anthracyclines are mainly used for lymphoma, leukemia, and they are the most cardiotoxic. You know what is the name of the drug? These are rubicin, doxorubicin, daunorubicin. They have the risk of dilated cardiomyopathy due to iron overload. Dilated cardiomyopathy. Ruby, red color because of iron. That's why we use the dexrazoxone as antidote. Right? So, bachche, anthracyclines are highly toxic. With cyclophosphamide, mainly you will see the hemorrhagic cystitis. And for prevention of hemorrhagic cystitis, we use the Mesna. Okay, so this is again important. Okay guys, anti-malarial, very important topic. Which of the following is a chemoprophylaxis of choice in a scientist who is on a journey to endemic malarial region and staying for 2 months in chloroquine resistant area? 2 months means 8 weeks. 2 months means 8 weeks. So which drug is this? 8 weeks. Which drug is this? Yes, 8 weeks. बताओ बच्चे. Chloroquine, quinine, doxycycline, mefloquine. Which drug is this? Chloroquine resistant malaria. So no chloroquine. Quinine is not for prophylaxis. If less than 6 weeks we use doxy. If more than 6 weeks we use the mefloquine. Very good बच्चे. So every week you have to give mefloquine till 4 weeks after end of journey. After end of journey for 4 weeks we give the mefloquine. So that is for prophylaxis. In acute malaria we use the ACT. So those are for acute condition. Artemisinin combination therapy. In acute severe complicated malaria, artesunate is best or quinine is best. So best is artesunate, second option is quinine. Less than 6 week adi we use the doxy. Okay, very important topic, emergency contraception for a 23-year-old female who is a victim of sexual assault few hours back, 13th day of menstrual cycle. So definitely we need to give the emergency contraception to this female. The options are OC pills from next cycle, IUD, levonorgestrel or levonorgestrel 0.75 or 1.5. So in emergency contraception, few hours of sexual assault, so within 72 hours, the preferred is levonorgestrel, not OC pills from next cycle. She is not pregnant, she is not married, she is 23-year-old female, young female, so definitely we don't prefer the OC pills. So IUD obviously not, so we use levonorgestrel and the dose should be 1.5, not 0.75. What is the drug within 5 days? The drug within 5 days, what is the drug? Ulipristal. Ulipristal within 5 days, Ulipristal, SPRM. And within 72 hours, we use the levonorgestrel. So C only, C, right? Not D. So it is 1.5 gram. Okay, very important topic again. 34-week pregnant lady developed convulsions as well. Blood pressure is 200. What is the drug you will start in this patient? Very simple. Oral labetalol dose. Doctor Sahab, see the dose. The answer is not D because you have to see the dose. Oral labetalol, IV labetalol plus magnesium, IV lorazepam or IV enalapril. What you will start? Definitely you can give, but we have to see the total dose na बच्चे. Why you are just presuming कि 2 tablet देंगे sir 0.75 की total dose is 1.5. Obviously we give the 2 tablet of 0.75, but we have to see the total dose. So don't presume. Okay, so oral labetalol, IV labetalol plus magnesium sulfate, IV lorazepam or enalapril. So in this case definitely will don't use the enalapril. Definitely IV lorazepam is for status epilepticus, not for this patient. This is a case of eclampsia. The patient is having high blood pressure as well as seizures. So definitely we have to start both. We can give, but the patient is having convulsions, bache. The patient is having convulsions as well as high blood pressure. So we have to give the IV labetalol plus magnesium sulfate. Don't forget the magnesium toxicity, loss of deep tendon reflex, and the treatment of magnesium toxicity is, any bacha, what is the treatment of magnesium overdose? If magnesium overdose, loss of deep tendon reflex, what is the treatment? Any bacha? The treatment is calcium gluconate. So in hyperkalemia, magnesemia, the treatment is calcium. Match antidote. Heparin with calcium gluconate. No. Heparin is protamine sulfate. Heparin is acid, protamine is base. Ethylene glycol. In ethylene glycol, we use the fomepizole. Valproate, nifedipine. Nifedipine is calcium channel blocker. We use the calcium. What about valproate? What about valproate? So this is not correct. This is not correct. This is not correct. Valproate causing liver toxicity. L-carnitine to treat the liver toxicity. So it is decreasing the risk of hepatotoxicity. It decreases the risk of hepatotoxicity. So why we use L-carnitine in these patients? To decrease the risk of hepatotoxicity. That's why we use L-carnitine in the valproate. Glucagon is the drug for beta blockers poisoning. Beta blocker poisoning or for hypoglycemia. Okay. 37-year-old intravenous drug abuser admitted with fever, chills, fast heart rate, fatigue, night sweat, joint pain in the muscles pain, persistent cough, swelling in the feet, leg, abdomen, small areas of bleeding under the nails and red painless skin spots in the palms and soles. Blood culture is showing the staphylococcus. So in the long questions, don't be irritated, don't lose the patience. They have given the final result, MRSA. So they are saying that patient is having infection and MRSA infection is there. What is the antibiotic you will use in this patient? Cefepime, imipenem, cefazolin or linezolid. In MRSA we don't use the beta-lactams because alteration of penicillin binding proteins, right? So what we use? We use the vancomycin or linezolid. We use the vancomycin or linezolid in the MRSA patient. So don't forget the linezolid, vancomycin for MRSA patient. Right? Simple question है, तो घबराना नहीं है. Always remember, long question means simple question. The drug not recommended for pseudomonas. So don't forget the pseudomonas infection as well. In pseudomonas, which drug is not used? Ceftazidime is best. Piperazolin is the best cephalosporin. Gentamicin we use. दोनों combine करके. Which drug we don't use? It is not effective. That is vancomycin. That is vancomycin. So don't use vancomycin in pseudomonas. It is not effective basically. So in pseudomonas nowadays we prefer the ceftazidime or amikacin. Piperacillin is the good penicillin as well. If resistant we use the important drug polymyxin E, that is also called as colistin. So colistin is the drug for resistant pseudomonas infection. Don't forget the resistant infection. 53-year-old alcoholic man suffering from liver cirrhosis admitted in emergency department with nausea, vomiting, lower abdominal cramps. On examination there is prominent veins on the abdomen. Ascites was noted. Which diuretic you will start? So what is the diuretic of choice for ascites, or you can say the cirrhosis patient? Which you will start? Piperacillin plus tazobactam, we use the combination, not alone tazobactam. So which antibiotic you will start? So in ascites patient, again the selection of diuretic. The selection of diuretic. Toracamide is the loop diuretic. Loop is good for pulmonary. Mannitol is the this cerebral. Astazolamide is for mountain sickness. It is for mountain sickness. Mannitol is for cerebral edema. Loop for pulmonary edema. It is the spironolactone, which is the drug for these patients. And I told you one important drug for CKD patients nowadays, finrenone. Don't forget the finrenone in CKD patients. The finrenone is the drug for CKD patients, approved for CKD. Finrenone is one of the drug for CKD patients, same group of drug. But in ascites patient, what is the role of mannitol? Tell me. If you give the mannitol unnecessarily, patient will have the problem with the increased blood pressure. Okay. So other than this, I request all of you read the TB. because in PSM it is covered, so I have not covered. TB, read the HIV, again PSM plus pharmacology, and read the dyslipidemia. These three topics. Please read these topics also. So that's all about the important topic. I wish you all good luck. I know तुम अच्छा पढ़ रहे हो, अच्छा करोगे, and you will all going to rock. You are all going to crack. I told you, जो लास्ट दिन तक पढ़ता रहेगा सिलेक्शन 100% उसी का ही होगा. तो कीप स्टडिंग, कीप रॉकिंग. आई गारंटी यू विल पास. तो एक साथ बोलेंगे वी विल पास. डेफिनेटली यू विल पास, राइट. तो बच्चे मिलते हैं एग्जाम के बाद. PDF बच्चे उस पर डाल देंगे हम, जो आपका टेस्ट हुआ उसी पे डाल देंगे, राइट, ऐप पे. ओके, और ग्रुप पे शेयर कर दूंगा मैं, टेलीग्राम ग्रुप पे. ओके बच्चे, सी यू, बाय बाय, टेक केयर. प्लीज बी कॉन्फिडेंट, घबराना नहीं है, लड़ना है, राइट. पक्का पक्का पक्का. ओके गाइज, बाय बाय, टेक केयर. इस कोई भी डाउट हो आप इंस्टाग्राम पे मेरे से पूछ सकते हो. आपके सामने इंस्टाग्राम हैंडल है, आप इस पे मेरे को मैसेज करना डेफिनेटली, राइट. ओके बेटा, स्टेटिन्स में बिकॉज ऑफ लीवर टॉक्सिटी. ओके, चलिए बाय 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 बाय, टेक केयर, गुड नाइट गुड नाइट गुड नाइट, नमस्कार, धन्यवाद.